Now, another big focus on WION, the COVID dread is back. Cases in China are soaring. The country's top health experts have said that the country is in the middle of the first of 3 expected COVID waves. Now, South Korea has reported over 88,000 COVID cases in the last 24 hours alone. With infection surging in multiple countries, India is moving to step up genome sequencing of COVID-positive cases. In the latest report suggests that the Indian Health Minister will be chairing a task force meeting later today. India's Central Health Ministry has asked state governments to send samples of positive cases. This will be done to nationally designate genome sequencing labs, and this will also help the authorities in detecting newer variants circulating in the country. The states have been requested to ensure that the samples are sent to the labs on a daily basis. The move comes after a sudden spurt in cases. Not just in China, but also in Japan and South Korea, the COVID-19 cases in China are increasing. With crematoriums and hospitals struggling to cope with the surge in cases, China has also changed the criteria for what's a COVID-19 death and what is not. It says that deaths caused to respiratory failures after contracting COVID will be recorded as COVID death, but it won't record deaths caused due to heart attacks or underlying diseases after contracting COVID. According to experts, the COVID-19 deaths in China are likely to reach millions. The United States has also warned that the outbreak is now of concern to the rest of the world, considering the potential of further virus mutations. Meanwhile, India, which suffered badly at the height of the pandemic, has so far not reported any significant rise in cases. Now, for more on this, we are being joined by Professor Nikolai Petrovsky from Adelaide. And welcome to the broadcast, Professor.
Thank you.
Now, the visuals coming out of China are extremely worrying. Many are also getting reminded of their own worst days of the pandemic. How are you assessing the situation?
So the situation is quite serious because what we have to remember is most people in China have not been previously exposed to COVID, so there's no natural immunity, which means the virus is going to spread like wildfire now that they have released the controls. It's expected that up to 1 billion people are going to get infected in China over just the next 2 to 3 months. Not only is that going to be a massive problem for China's health system, but of course with 1 billion transmissions, that's 1 billion opportunities for the virus to create deadly new variants. As we've previously seen, in 2020 when it was spreading in other countries of the world. So it may well be that we'll see a lot of new variants emerge out of China. And it's possible that some of those variants may not be as benign as the current Omicron strains that are circulating in our countries right now. So it is a very concerning situation.
Now, Professor, if we talk about China specifically, there is a growing speculation that the death toll might be much higher than the official toll. At this point, it is becoming difficult for even news organizations to get the real picture. So how do you think are the residents coping?
Look, I think, it's always difficult knowing whether the data we're getting out of China is accurate or not. We experienced this at the beginning of the pandemic in 2020. Where there's still a suspicion that the tiny numbers of initial COVID cases that China reported were a massive underestimate. The problem was much bigger than they let on. So it wouldn't be surprising if the same situation is occurring now. I've seen reports that they've had 3 deaths in the last few days. You'd be expecting with the extent and spread of the virus, death toll would already be up in the order of hundreds or thousands of people a day. It's hard to believe that it really is 1 or 2 cases a day that are being officially reported. So I think we do have to be quite sceptical of the nature of the data we get out of China.
All right, now the previous waves that we saw was mostly driven by new, more infectious and more deadly variants. I want to ask you, what do you think could be the reason this time, and what kind of action do you think the governments should take?
So one of the problems of viruses is that as they mutate, they may become less lethal, and we've seen that when we went from Delta to Omicron. Omicron overall is a lot less lethal than the predecessor Delta. It's much more infectious, but less likely to kill you. It's not a one-way path, however, and as we know with influenza, some years we'll have a really bad influenza outbreak that's very lethal. The next year we may have a very mild. So with COVID, we can't assume that the virus is going to become less lethal over time. And so the worry when we see a large number of infections, occurring in China is out of that may come a more lethal variant. So we have to really be on our guard. There's nothing we can do about it. If it happens, it happens. But obviously what we can try and do is control the spread of any new variant back out of China into other countries and obviously monitor very closely the nature of the variants that are being generated in China.
All right. Thank you for all those insights, Professor Nikolai Petroversky.